Antifungals. So fungal infections, funguses break into two groups. So there's molds and yeast. And when we talk about fungal infections, there's usually two types. There's superficial, which would be something like ringworm, and then there's systemic, which would be internal, and that would be something like blastomycosis or aspergillosis. And these are all infections that you can get usually through the environment. So antifungals come in two types. There's fungicidal as well as fungostatic, and usually they work by interfering with the RNA or the protein synthesis of the fungus, and they disrupt the fungal cell wall division. So there are Polyene antifungal agents. Nystatin. This is usually a topical. It's used for local infections. And normally it's used for things like otitis externa. It can be given orally for yeast infections, and this would be if it's secondary to use of antibiotics. And then there is amphotericin B. This can be given IV for systemic infections. It also can be used topically for local infections. It stays, once it distributes into the tissue, it stays for a long period of time, which is why it works really well. The IV injection can be nephrotoxic. So imidazole antifungals, imidazole. These cause leakage of the fungal cell membrane. They're broad spectrum. The problem with them, though, is that they have a delayed onset of action. And when we're talking about antifungals, they have the prefix of azole, A-Z-O-L, and those some examples would be ketoconazole, which would be systemic and you could use for systemic and local infections. Then there's miconazole, which is usually used topically, and you want to think of that as like athlete's foot, or if you have a yeast infection, you might use that as well. And then there's fluconazole. They use these for systemic infections as well as yeast infections. So then the last one that we're going to talk about are superficial antifungal infections, and these disrupt fungal cell division. And even though we're thinking like superficial, so things like ringworm, we use an oral medication called griselfulvin. This can be given to cats with ringworm, especially ringworm that's not responding to other treatments. It needs to be given with a fatty meal because that is the best way it absorbs into the body. Then there's also something lufuron, which is also called program. It's used as it is actually a topical ectoparasitic. So it's used for fleas, but it also has use for treating ringworm in cats.